Here at the Greater Arlington Chamber of Commerce, we have a little over 1,000 members of pretty much anything you can name, to all sorts of different sizes. We have one-person operations to places with thousands of employees. But one of the bigger ones that we have here, of course, is all the hospitals that we have in membership here at the Greater Arlington Chamber of Commerce. And we're blessed to have one of them in studio with us today with Texas Health Arlington Memorial Hospital. This is Ken Rothfield, MD. Ken.
It's great to be here. Thank you, Bryan.
It's great to have you here. Now, your official title now, and get this right, Chief Quality/Medical Officer.
That's exactly right.
What does that entail? What does that mean you do?
Well, I'm the doctor who's in charge of a bunch of areas, including safety and quality outcomes for our patients, our medical staff office, which manages all the affairs of our doctors to making sure they have the appropriate credentials. I work with our infection prevention team that is there to make sure the environment is safe for our visitors, staff, and patients. And I also work with our care transition management team. Those are case managers and social workers who make sure that every patient in the hospital is going to the right destination after we're done taking care of them.
Well, as a prospective patient myself, I guess we all are, it's nice to know people like you exist out there. But I was reading your background prior to you coming to the studio with us today, and you have a very extensive background. I mean, you've been doing this part of the world now for 10, 11, how long? What years?
That's right. I've been a chief medical officer for 11 years,
Right.
6 of them with Texas Health Arlington Memorial. But before then, I was a practicing anesthesiologist, and I worked all over the country in a lot of different areas. I predominantly did cardiac anesthesia, so I specialized in doing anesthesia for heart surgery, but in addition to that, I helped start anesthesia departments at a number of community hospitals in Maryland and ran those departments. And then after about 21 years of practicing in the OR, I got very involved in patient safety and patient safety research, and I decided to spend the rest of my life doing that.
Well, we're honored to have you here in Arlington. We appreciate that. And I wanted to touch on one more thing because I found this fascinating. You actually had your own personal medical experience that had a big impact on what you're up to today, didn't you?
I did, and I'll give you the backstory on that. About 10 years ago, when I was a brand new chief medical officer, I discovered that I had a hernia, and it started bothering me. So I saw my most trusted doctor in Baltimore, a guy I'd worked with hundreds of times, and he said, "Ken, you have bilateral hernias in your groin." So I checked myself in to have the surgery, and I thought it was going to be really easy. I had the surgery on a Monday before Thanksgiving, thinking that I'd only have to take a couple days off from work, and it turned out to be a disaster. And without going into all the details, I had the worst complication you could possibly have, brought me back to the hospital for extensive emergency surgery. After my minimally invasive hernia surgery, I had maximally invasive surgery to save my life, and was laid up for a few months after that.
Wow.
And before then, I had been teaching doctors, nurses, and administrators how to have compassionate discussions with patients after things go wrong, or even after medical errors. And I was really good at teaching people how to sound empathetic. But I'd never seen the world through the eyes of a patient. And I was at a hospital where I used to run the anesthesia department, and I thought I was going to die there. And that was a very lonely experience. I realized how vulnerable our patients are, and I knew that in a more internal level. Before that, it had been very academic. But when it's you in a hospital bed, trusting the doctors, nurses, technicians, and the housekeepers to take care of you, it's a very different experience. And I got better. I went back to work. It ruined my underwear modeling career, that's for sure. And it forever changed the way I see patients, because as an anesthesiologist, I'd visit a patient, talk with him for a little bit, and in the operating room, it became a black box of physiology. And now when I see patients, the first thing I see are people suffering. And it's a different lens, which has stuck with me. And I think it's also really amplified my own really authentic sense of empathy towards the people we take care of.
Well, empathy is the key word. I was hoping you'd get to that. Are you able to, in your position now, to impart that empathy on the ones that you supervise and let them know exactly why it's so important?
Yeah, I think, again, when you come to healthcare from a very academic perspective, it's easy to be detached. When you've been on both sides of the playing field,
Sure.
It's different. And I like to always bring back everything we do to what it really means. So if we talk about, we had a 10% reduction in a certain kind of infection, what does that mean? Well, those infections have a certain mortality. And if you reduce those by 10%, maybe 3 people left your hospital alive who might have died. So it is bringing everything back down to the patients and their stories, and so that they're not just statistics.
Well, you're a living example of the old adage, it's only minor surgery when it's on someone else.
That is so true. We're so used to thinking of it, oh, it's a minor procedure. It doesn't matter how minor it is.
Correct.
It's all a big deal. And I've experienced that too now, where I've had a minor procedure that I would have brushed off for a patient, but for me, it wound up being everything.
I remember my own mom was in the hospital, not your hospital, another hospital for a minor surgery. And the surgeon was just so great afterwards. We were talking and everything. And I said, Doc, I want you to know one thing. I know you've done this procedure hundreds of times before, but you've only done it on my mom once. And I appreciate that. So you seem like that kind of man yourself. So thank you. Thank you for being empathetic for all of us out there.
It's the most important thing we can give our patients. You know, our patients come to the hospital and assume that the technical expertise will be there. But what they really need are people to understand what they're going through. And although our patients come to us with a lot of different medical problems, they all share one diagnosis to one extent or another, and it's hopelessness. And every interaction we have with our patients can either make that hopelessness worse or make it better. And so that's what we really try to do as a team, to make sure that patients have less hopelessness about being in the hospital and can see that there is going to be a tomorrow where they'll have that behind them.
Well, let's talk about the hospital itself. The hospital has now been around in Arlington for 68 years.
That's exactly right. We just celebrated our 68th birthday.
That's outstanding, but there's always stuff changing out there. And in the time we have left, let's talk about some of those things. Three things in particular. Now, talk about the women's. What have you got going, the women's?
Our women's center, so our labor and delivery women's center has been completely renovated. It's not quite done yet, but we're getting close. So we've got a major facelift of that area. And it was important to us to have an area that reflected the quality of the care that we're providing. And, you know, the building's been there a long time with a lot of additions, but that area was really in need of a refresh. And so we followed some similar themes that we used for our breast imaging center, which was renovated recently. And it's an amazing, beautiful, tranquil, spa-like environment. And that's what we'll be offering moms having babies at our hospital. And we're really proud of it. It really provides the dignity and comfort that moms and their families deserve, and I think it'll be just a huge benefit to the community to have that environment in addition to our highly skilled OBGYN team.
Very nice, very nice. Well, another thing that could impact men and women, the stroke part that you had going on at the hospital.
Correct. We have always been a stroke center, but we haven't been able to do everything. So when patients have a stroke, that's a blood clot or bleeding in the brain. It's a game of minutes, because every 2 minutes, 2 million neurons die. And neurons are the cells that make up the brain, and they don't grow back. So time is of the essence in treating a stroke. Some patients who have a stroke, in addition to needing clot buster medications, they actually need the clot mechanically removed. And that is not something that we offered or that a lot of hospitals offer. So if somebody came to our hospital with a stroke, we did our imaging, and the diagnosis was this patient needs a thrombectomy, removal of a blood clot, we'd have to pack them up and ship them to one of our sister hospitals in Fort Worth or Dallas. We are now thrombectomy capable, so which means one of our radiologists, our neuroradiologists, performs a minimally invasive procedure to remove those blood clots. And we've done several since we started doing that, and it's worked out really well. And that saves 2 million neurons per minute. And if we don't have to pack up a patient and ship them to another hospital,
absolutely,
it's a huge advantage. The main goal is we want to be able to provide all the care that people need in our community without them having to go to other hospitals. And we don't do every last thing, but we continue to expand, and we will continue to expand our stroke program as well.
You know, the last thing I want to touch on too, Ken, is this the way the robotic stuff keeps growing. I actually got to take a tour over there before with the robotic stuff, but it's not done yet. You continue to enhance that program as well.
Correct. You know, robotic surgery is not that new. Robots have been in healthcare for a couple decades now.
Okay.
But the technology continues to evolve, and we now have the most advanced version of the Da Vinci robot, or the DV3 we call it. Mm-hmm. And it is a platform that enables surgeons to do things you just couldn't do before, because There are operations where you just can't get your hands in there, but you can get robot hands in being controlled remotely. And it's important to know that robot's not doing the surgery. It's being done by a surgeon.
Thank you for pointing that out. That's a big misnomer.
Yeah. It's a tool for surgeons to use, and surgeons require special training to use the robot, but they're using their fingers, and the robot manipulators are operating as an extension of that. And enables doctors to do things you just couldn't do because the robot's hands have no tremor. They can go into very tight spaces. We have advanced cameras that allow visualization, and it's less invasive, less tissue destruction, smaller incisions, quicker recovery, getting home sooner. So it's an incredible benefit, and now we're using the most advanced platform, and we are an extremely busy surgery with robotic surgery, and we have many talented surgeons using that platform.
Are we at the position here with your hospital to where other hospitals send people your way because they don't have it themselves?
Yes, not every hospital has the equipment, and not everybody has the talent either, and we're lucky to have both.
No, we can't have one without the other, I wouldn't think.
That's right.
Okay, then I'm going to ask you a really odd question here. If you have the equipment, are you able to attract talent that maybe you wouldn't have attracted prior to getting the equipment you have now?
Absolutely, because the people in training now are training on this technology.
Okay.
This is part of residency training. So for a young general surgeon or thoracic surgeon or a GYN surgeon, they're going to want to use the most advanced technology that they trained on. So if you're going to attract the best talent, you have to have all the technology there to support them.
It's interesting how that works, but I'm so glad it does here in Arlington, Texas. It's awesome. You touched on this earlier when we first started, but one of the creeds there at the hospital, it's individuals taking care of individuals. Expand on that a little bit.
What you just recited is called the Texas Health Promise, and I'll say it again, it's individuals caring for individuals together. And it's just 5 words. It's very easy to remember. And when you look at it, it's only 4 unique words. And what it really means is, I'll just go through each word. Individuals, the staff of the hospital, the doctors, the nurses, the techs, the folks in the cafeteria, our environmental services folks, we're all people too. We all come from different backgrounds, we have different beliefs, and we all work together. The caring part is what we just went over. We want to treat everybody with empathy and compassion. Then the word individuals comes up again because our patients are individuals. They're all different too, and they're not just a diagnosis. They're people with their own wants, needs, fears, hopes, and we want to respect that. And then the last word is together, because none of us can do it alone. It takes all of us working in a team to make it work. And it sounds like another corporate catchphrase, but it is our North Star at Texas Health, and we live it every day.
You live it every day, and you live it through people like yourself, quite frankly. I mean, they were living it before you got there, but they were able to attract someone that was already living on your own to get together to come in as well.
Well, that's kind of you to say that, but I really feel like I'm working with the people I should have always been working at my whole career. And I've been at many different organizations. I've never worked at an organization like Texas Health. It's made the most authentic commitment to patient safety, which is a very big deal, of anywhere I've worked. And I've never worked with so many outstanding people. And I just feel fortunate to be able to go to work every day and work with an outstanding bunch of folks.
Well, we hope you don't plan on going anywhere anytime soon. We kind of like you being around here.
I don't think I could be recruited away from this role.
That's all. I think that's an ender right there, folks. Well, Ken, thank you very much. We appreciate you coming in the studio with us today. Obviously, you're very busy, but it was nice hearing the passion in your words and your backstories of how you got to where you are today, from anesthesiology to being kind of in charge of a bigger platform today. But always remember that it's individuals. We appreciate that.
Well, thank you. It's been an honor and a pleasure.
Thank you. Folks, thank you for being here as well. And you could tell he said it more than once, that word together. He didn't tie it in with us, but I know he's a big believer in that together we succeed whatever we're doing. We believe that here too at the Chamber. Take care.